So now let's look at the nutraceuticals, or the supplements, the vitamins and minerals and other nutrients. We shall begin with the sunshine vitamin. So according to NIH, there is insufficient data to recommend either for or against vitamin D for prevention or treatment. So let's look at the data and consider our own interpretation. I am always one to see for myself rather than just believe what I'm told. So this study from Spain looked at hospitalized COVID-19 patients and gave them a vitamin D3 analog in addition to standard care. And they lowered ICU admissions from 50% down to 2%, and they eliminated deaths. That is quite phenomenal. So, vitamin D, what have we got to lose? More data. This is an early Indonesian study. I think this came out in July. 50% of COVID-19 patients with inadequate vitamin D levels died, and only 4% of those with normal levels died. They looked at 780 cases. They did not do any intervention with vitamin D. Adjusting for the comorbidities and the age and the sex, low vitamin D patients were 10 times more likely to die than patients with normal values. And the study we just looked at from Spain says that, hey, you can support it and you can still help them even if they come in low. So the mortality in patients that have a vitamin D level greater than 30 is minimal compared to if the vitamin D level is less than 20. So vitamin D level greater than 30, according to the Indonesian study, decreases the risk of severe disease by 90% and decreases the risk of dying by 96%. So based on this data, I'd say everybody ought to go out there and make sure they're taking vitamin D. In fact, based on this data, there were some governments that started handing out vitamin D, including in England. More data. This is almost 200,000 US patients. The vitamin D level, again, correlating. In this study, they looked at the SARS-CoV-2 positive test, okay? Much higher chance in patients that had a vitamin D level that was low. So the people with a higher vitamin D level had a much lower chance of turning up with a positive test. So having a good, healthy vitamin D level was protective. Another study, this is from Israel, vitamin D level greater than 30 had a 58% lower risk of testing positive compared to those with vitamin D level below 29. Okay, definitely a line there, but you know, for me, I like patients' vitamin D level to be higher, above 50 for sure, and somebody I'm worried about, maybe even 70. Normal levels go up to 100, so we're definitely not violating the normal range. So again, vitamin D deficiency and outcome of COVID-19 patients. Again, vitamin D below 12, 6 times higher risk of severe disease requiring invasive mechanical ventilation, 14 times higher risk of death compared to those with a vitamin D level above 12. Okay, that's pretty low level to begin with, but big difference. So we have known for a long time vitamin D deficiency increases the risk of acute viral infection. I've given you a reference there from 2015. Taking vitamin D prevents acute respiratory infections. That's a study from 2017. We know that vitamin D is beneficial for preventing and fighting viral respiratory infections, and yet we're not promoting this at all. We are promoting mask wearing and social distancing, but there is no mention of vitamin D in mainstream media. So how much vitamin D shall we take? Okay, I've given you guidelines here, but what have you got to lose? If we're wrong, okay, because NIH says, oh, we don't have enough data, we can't recommend for or against. All right, so let's say you take it and you really didn't need it. What are you going to hurt? Okay, what consequence are you going to suffer? You might be healthier because you'll get a ton of other benefits from the vitamin D. So there is nothing to lose by optimizing your vitamin D level, and a lot to gain.